Nanomedicine. So I do both. First of all, clinics every day and also research. And due to the fact that we do also clinical studies, of course, in Erlangen, I would like to give you some view from my side. I do focus now in my talk concerning cancer because it's really very life-threatening. Everybody knows this. About 1.6 million people are developing diseases, cancer diseases in Europe. About 1 million die. In Germany, around 500,000 new cancer patients develop every year, and around 224,000 people are dying of cancer. Now, therapies are done. I'm a surgeon also. If you can do an operation in a patient suffering from cancer, is always the gold standard. Removing the cancer, if it's possible, in healthy margins, is always the best option, but often it's not possible due to several reasons. So radiation, chemotherapy, or hormone therapy is implemented. And now in Madrid in 2014, there was a study published that among 8,000 patients suffering from cancer, they could not be operated, they received chemotherapy. And 563 of these patients received chemotherapy, as I mentioned, and they develop really severe side effects. And they have to stop the chemotherapy. And what was the solution then? They will die. There is no other option. And this is a really bad situation, especially for physicians, to say that we cannot offer you anything else. Probably you will die, and just order your private things. And this is really hard. This is really very bad situation, and I think clinical trials have to be done to solve or overcome this problem. Okay. Now, what you're talking about, these are patients, young patients, females suffering from breast cancer, head and neck cancer patient. They look at you and they say, you know, what can I do? If you are then in the oncology unit, as I'm working, and we have our rounds every Wednesday, around 40, 50 patients are presenting, and they say, you know, we do standard therapies if it's possible, but very often we cannot do any standard procedures anymore. And this is very hard because then we have to offer them an option, at least to give them hope, and at least to give them some beneficial for the last time period of their life. And then we are talking about clinical trials in this field, for example. And what are patients asking every day? They ask, why should I join in this clinical trial? Sometimes it is easy to say, you know, otherwise we cannot offer anything else. This might be an option. And what should we other than, they ask, for example, should I try something that hasn't been approved? Are you sure, doctor, that if I get this trial or this new product, whatever, that they will have some benefit from that? This is a real difficult question, and often where we have discussed this extensively. And if the patient has a family or relatives, they're potentially involved in this procedure, of course. And then you have to really discuss also with the relatives. Maybe they have a different view. They say, you know, my aunt is 80 years old, she had a nice life, the aunt wants to live longer, but the family say, is it really worthwhile to do this? There's a lot and extensive discussions there. And of course, age of the patient is sometimes crucial. If you have a young child with 2 years, 3 years, maybe there's a different situation comparing to somebody who is 90, 95, but this is an ethical view. So therefore, I think it's worthwhile to discuss it also in our panel. And they ask about risk and benefits, of course, generic question. Now, from a physician view is, what is our motivation to do this? Of course, we want to help patients. This is the first aim. We want to help patients. This is this every physician wants to do. And the results from this clinical trial help to answer a lot of questions and provide also guidance for practicing healthcare professionals. So to give them a guidance from one center to worldwide, hopefully, and to attempt, and this is the biggest issue, to improve the status quo, because nobody wants to have, as a physician, these borderlines to say, you know, we cannot do anything. We always tried our best, beside best supportive care, to really cure, or let me say, bring the patient in a better situation. Now, what are possible benefits? If you are discussing with patients, you have to offer what are the possible benefits. So participation is something that, of course, to get a better treatment for the disease, we do argue in Erlangen, or researchers should argue, and to learn more about how diseases can be prevented, identified, and of course managed. And if the treatment is being studied is more effective than its standard treatment, it is really important that the participant may be the first to benefit. This is the hope we can give a patient. That potentially, if the trial will work, then it is potentially the benefit for the patient. And one benefit might be also if you are included as a patient in a clinical trial, you may be checked more physical condition more frequently than somebody who is receiving the standard therapy, for example. And of course, it is also that if you may get an experimental treatment for life-threatening illness, it's the option that you will receive this and potentially you will benefit compared to somebody else who is not in the clinical trial. Of course, there are risks, and we have to discuss this very extensively with the patient. Unpleasant, as we have heard, serious side effects, life-threatening side effects can occur, of course, in any clinical trial, in any treatment, but also in any clinical trial. And the thing is that you have to be aware also if the clinical trial you apply is the experimental treatment and the treatment or the placebo instead is there. Can you offer another standard treatment? We have now a big discussion in Munich. There was a pediatrician who made genetic therapy in rare diseases, and they said, 3 of 7 died, and he did not offer the standard treatment. So therefore, he had really a big struggle now with people there. He offered them. He was really very transparent, but it was a really hard situation because he did not really explain the experimental treatment compared to the standard treatment, where the beneficials are, or should we first start the standard treatment and then the clinical trial? And of course, the experimental therapy may not work. It may not better or even good as a standard treatment in the respective condition. This is one thing. If you take this clinical trial, all the efforts, maybe it will not work. We cannot promise in advance that this new clinical application will work. Most challenging from a clinical researcher's view is the selection of patients. And this is to define this. This is really, you can write proposal, whatever, but you have to make individual decisions. What patients will really be the right, appropriate patient for this clinical trial? And therefore, it's very important that you have a team who have a detailed knowledge about the severity of the patient's disease, and is obligatory for everybody. Physicians, nurses, everybody. We have to be a team. The patient, relatives of the patient, the family doctor, everybody has to be involved, because otherwise maybe you miss an important information and then you fail with your clinical trial. And of course, you have to have intensive and transparent discussion between the physician, researcher, and the patient. This is obligatory. So taken together, it's an ambitious thing doing clinical trials, and not only focusing on significant difference to standard therapy. If you are treating patient, this is my standpoint of view is that you have always be the patient as a partner in the team. And this is very important because very often clinical trials are sponsored by industry, and they have, of course, an economical bias. But I'm treating patients. I don't fulfill any economical interests. But on the other side, I am aware that you have to have both. If you don't have the industry as a partner, unless he wants to make money, you are not able to do clinical trials. So therefore, this is it's a ambitious, heterogeneous position as a researcher who is doing clinical trials. Of course, detailed information has to be given about the pros and cons, and you have to give the patient time to think about. Not only 1 or 2 days, you have to give him really time that he can make his right decision. And it might be also very good that you include confidence in this decision process. So to summarize, clinical trials are of outstanding importance to promote medical achievement. Potential for improvement of the patient's care is essential. Performing a climate of confidence and transparency is obligatory. If you don't do this, if the I mean, both sides. The patient has to be trust in the physician, but also on the opposite side. If you don't have a patient, if you don't have a good feeling, if you don't trust in them, you can do this. There's also a matter of compliance from the patient. If you start a clinical trial and they stop due to private reason or whatever, it's hard. You spend a lot of effort, you spend a lot of money, so therefore you have vice versa reaction. And I think, from my standpoint of view, clinical trials should be sponsored by independent funding sources. This is always difficult because if you ask a European Commission or other official funding organization, they won't do this. They say, no, you have to ask the industry because you want to translation, blah, blah, blah. This is okay, but if you want to do basic research beside any economic bias, it's better to have independent funding sources, for example, private foundations. Also, but also the tax money payers' money, I think it's worthwhile. Yeah, I want to only focus on my team. SEON concept is that we are producing nanoparticles, characterizing, make nanotoxicology, preclinical study. We want to do clinical studies in Erlangen. And the thing is, as I mentioned, we have a vice versa interaction. The patient has to be trust in the researcher or in the physician, but also the researchers have to have in mind what are they doing the whole day. In my group, there's a clear focus. We say we want to hopefully improve oncology treatment, cardiovascular diseases, and we want to also go into imaging. But you have a vice versa action that also a biologist or a pharmacist or a nanotechnologist say that what he's doing in his basic research is for the better of the patient. If you do transport this, beside the money he is earning every month, maybe he has also a good motivation in the group. Yeah, this is the group in Erlangen, what we are doing, and if you like, you can have copy, and we have downstairs an exhibition hall, a special issue on nanomedicine published together with Bengt Fadel, where we also address these issues in some points. Thank you very much for your audience. Thanks.